Hello everyone, I am Dr. Srujana Joga, Consultant Medical Oncologist at AOI Mangalagiri. March being the Oral Cancer Awareness Month, so let's see how we can know the symptoms and what are the risk factors and signs and symptoms, as well as the treatment modalities and the questions by different age groups, so that they can get cleared of their doubts.
Good morning, ma'am. Myself Dilip Nandru. My age is 18. Can teens get oral cancer or should we watch for it?
Teenage cancer, oral cancers are very unusual and very rare, even though they are not likely to occur, but it is still possible in at least 1 to 2% of cases to get oral cancer. So that you should be aware of that this age group is also at risk once you have some genetic factors or some familial cancer syndromes running, like the Fanconi anemia, in which there will be long lasting anemia where there is a genetic defect. Along with that, they are more prone for the oral squamous cell carcinomas. So in these children who are affected with Fanconi anemia, they get oral cancers at an earlier age, like 5 to 15 years. The other one is the Leaf-Romany syndrome, where there is a genetic deficiency in the P53 gene. So the mutation will lead to development of multiple cancers all over the body over a period of time at a very earlier age. Before 30 years of age, they can develop cancers. So they can develop even oral cancers at an early age, like 10 to 15 years or 20 years also.
Good morning, ma'am. I am Alexander. My age 28, ma'am. My question is, do lifestyle choices like smoking and chewing tobacco affect to oral cancer risk?
So smoking tobacco related products is one of the major risk factors for oral cancer. It accounts for around 80 to 90% of cases of oral cancer. So smoking previously in 1970s, smoking in the form of cigarettes, cigars and pipe smoking, these are the most common forms. With increased awareness, now the smoking is being banned in the public places. So people resorted to the smokeless tobacco, where the tobacco is chewed in the form of gutka, jarda, khaini, pan and these things. So if people chew a lot of tobacco related products, this nicotine and its related products get stained and remain over the teeth or your gums or the buccal mucosa, and over a long period of time, when these products stay there, they will cause inflammation, something like irritation of that particular mucosa, and which leads to changes in the cells. So this will lead to the oral cancer over a period of 5. It may be as early as 5 years, or it may be as late as 10 to 20 years also in some cases. It all depends on the metabolism of the tobacco related products for each and every person. So you might have observed that persons who have smoked more than, who have started early smoking and have smoked more than 10 years, still they don't develop any type of cancers. But a person who just smoked for 2 to 3 years, 2 to 3 years or 5 years will develop cancer. This is because their metabolism of the tobacco related products is different. The enzymes responsible for the metabolism are deranged or absent in some, due to which the products get accumulated and they are more prone to cancer. So we don't know which person is having which type of enzymes, so it is better to avoid smoking and get the oral cancers at this age. And lifestyle choice like alcohol also contributes to cancer development. So if you have both smoking and alcohol, that is called synergetic effect. So 1 plus 1 is equal to 2. This is max. But in science, 1 plus 1 is always more than 2. It may be 3, 4 or 5. So this is called synergistic effect. That is, the effect of two things will be more than doubled. So you are at more risk if you have both smoking and alcohol as risk factors to develop oral cancer in future. So apart from these two major things, smoking and alcohol, nowadays even in never smokers also, the oral cancers are being increasingly diagnosed at the age of 25 to 40 years. So why is this happening? This is because of exposure to the human papilloma virus, HPV virus. So you might have heard HPV causes cervical cancer, and it can also cause oral cancer also. So this is the most common form of common cause for oral cancer in never smokers. So being vaccinated with HPV can protect oral cancers also. So apart from smoking, alcohol and the viral infection like HPV, persons who are immune deficient, that is who are exposed to HIV, who are HIV positive, or who have received solid organ transplants like lung or liver transplants, they are at risk for developing oral cancers in future. And who had a bone marrow transplant also, in them also the patients are more prone to develop oral cancers or any type of skin cancers in future. The risk might be between 1 to 5%.
Morning, madam. My name is Radhakrishna. My age is 35, and my question is, what are the common oral cancer symptoms and when I should go to the doctor?
The common oral symptoms are like majority 90% of cases there will be a persistent sore or ulcer in the lip, tongue, teeth, or in the buccal mucosa, or in the floor of the tongue or the back of the tongue, on the tongue or on the borders of the tongue also. The second one is there may be a growth. It may be like a cauliflower type growth or like a lemon sized growth present in the oral cavity. And there may be patients might have red or white patches. So these are the predisposition conditions, that is these persons are likely to develop oral cancer if those patches are not treated adequately. So the other symptoms are like having a bad breath and loosened teeth because of the growth and the cancer cells. The gum tissue is not healthy and the muscles are not strong, and hence the tooth start loosening around it. And bleeding from the gums might also be one of the symptoms of oral cancer. And apart from this, these are the symptoms when the stage of the cancer is stage 1 or 2. And once it is advanced, it comes out of from the tissue, it presses on the nerves or the lymph nodes around the surrounding structures. So they might have ear pain or numbness of the face or difficulty in swallowing, and there may be a swellings in the neck. So these are all the advanced stages symptoms.